Hello, it's Dr. Seth Jarrell. Today I want to talk to you about insomnia. Insomnia is the inability to go to sleep. I hear this a lot. A lot of people have troubles with going to sleep. And there's a lot of different reasons for it, and medications are not always the answer because medications come with side effects, but sometimes it does require some medications. So, what is our first step to determine why you're having insomnia? Well, first we need to decide if you're having any other kind of medical problems that could be causing your insomnia. Anxiety can lead to insomnia, depression can lead to insomnia, certain medical conditions can lead to insomnia. So, the first thing we need to do is do a detailed history and physical exam on you. Second thing is we keep a sleep diary. A sleep diary is a diary that you write down everything about your sleep. You write down when you laid down, you write down how long it took you to go to sleep the night before, how many times that you woke up, and what time you woke up. It's really important to write these things down. You can also start to write down how much you exercised for that day and how long you slept. The third thing is proper sleep hygiene. So, what is proper sleep hygiene? Sleep hygiene are practices that you can do to help you get better sleep. So, the first thing is it needs to be regular. One of the best ways to train your body to sleep well is to go to bed and to get up at more or less the same time every day, even on the weekends and days off. This regular rhythm will make you better and will give your body something to work from. Sleep when you're sleepy is the second one. So only try to sleep when you actually feel tired or sleepy rather than spending too much time awake in the bed. The third thing, get up and try again. If you have not been able to get to sleep after about 20 minutes or more, get up and do something calming or boring until you feel sleepy. Then return to bed and try again. Sit quietly on the couch with the lights off. Bright light will tell your brain that it's time to wake up. Or read something boring like the phone book. Avoid doing anything that is too stimulating or interesting, as this will it will wake you up even more. Number 4 is avoid caffeine and nicotine. It's best to avoid consuming any caffeine, including coffee, tea, cola, drinks, chocolate, some medications, or nicotine, so cigarettes or dip, for at least 4 to 6 hours before going to bed. These substances act as stimulants and interfere with the inability to fall asleep. The third thing is to avoid alcohol. It's best to avoid alcohol for at least 4 to 6 hours before going to bed. Many people believe that alcohol is relaxing and helps them get to sleep at first, but it actually interrupts the quality of your sleep. So you may be thinking that you're sleeping better, but in fact, the quality of your sleep is poor. The sixth thing is bed is for sleeping. Remember that. Your bed is for sleeping. It's a sanctuary. Try not to use your bed for anything other than sleeping and sex, so that your body comes to associate the bed with sleep. If you use bed as a place to watch TV, eat, read, work on your laptop, pay bills, and other things, your body will not learn this connection. The next thing is number 7, no naps. No naps. It's best to avoid taking naps during the day to make sure that you are tired at bedtime. If you can't make it through the day without a nap, make sure it's for less than an hour and before 3 p.m. Okay, number 8. This one's really important, sleep rituals. You can develop your own rituals of things to remind your body that it's time to sleep. Some people find it useful to do relaxing stretches or breathing exercises for 15 minutes before each night of bedtime, or sit calmly with a cup of caffeine-free tea, so some of those sleepy time teas. Number 9 is bath time. Having a hot bath about 1 to 2 hours before bedtime can be useful because it raises your body temperature, which causes you to feel sleepy as your body temperature drops down again. Research shows that sleepiness is associated with a drop in body temperature. Number 10, no clock watching. So many people who struggle with sleep tend to watch the clock way too much. Frequently, you check the clock during the night, and this can wake you up, especially if you turn on the light to read the time. This reinforces the negative thoughts such as, "Oh no, look how late it is. I'll never get to sleep," or "It's so early. I have only slept 5 hours. This is terrible." That gets your anxiety up, and then you're not going to sleep as much. The next thing, number 11, is to use a sleep diary, as we talked about before. I'm going to give you a worksheet that kind of summarizes all the things we talked about. Don't let me forget to give you that before you leave or ask our secretaries. But this worksheet can be a useful way of making sure that you have the right facts about your sleep rather than making assumptions. Because a diary involves watching the clock, see number 10 as we talked about, it's a good idea to only use it for 2 weeks to get an idea of what's going on, and then perhaps 2 months down the track to see how you are progressing. Once we get there, we can stop the sleep diary. Number 12 is exercise. Regular exercise is a good idea to help with good sleep, but try not to do strenuous exercise in the 4 hours before bedtime. Morning walks are a great way to start the day feeling refreshed. So getting your exercise, extremely important. 150 minutes of intense activity a week can really help. If your body's not tired at the end of the day, physically tired, not just mentally, but physically tired, then you're not going to be able to sleep well. So exercise is a key component of getting good sleep. Number 13 is eating right. A healthy, balanced diet will definitely help you to sleep well, but timing's important. Some people find that a very empty stomach at bedtime is distracting, so it can be helpful to have a light snack. The key again is a light snack. But a heavy meal soon before bed can also interrupt sleep. Some people recommend a warm glass of milk, which contains tryptophan, which has a natural sleep inducer. Number 14 is the right space. It's very important that your bed and bedroom are quiet and comfortable for sleeping. A cooler room, so turning that temperature down just a little bit, with enough blankets to stay warm is the best. So make sure you have curtains that are blacking out the room, and that you have an eye mask to block out the early morning light, and earplugs if there is any noise outside your room. Sometimes that good noise maker is a good thing, the brown noise or the white noise, to keep out all the distractions that may be outside or within the house. And number 15 is keep daytime routine the same. This is very important. Even if you have a bad night of sleep and are tired, it's important that you try to keep your daytime activities the same as you have planned. Don't try to do things differently. That is, don't avoid activities because you feel tired. This can reinforce the insomnia or not being able to sleep. Okay, so let's say we've done all those things and we spent 1 to 2 months trying those things and we're still not getting some sleep. The next thing is sleep restriction. So sleep restriction is that we restrict you for a period of time to very little sleep. So you're not going to bed unless you're sleepy, and you don't lie in bed unless you're sleepy. So we push you back an hour later every night. If you go and you lie in bed for more than 20 minutes, the next night you're going to go to bed about 20 minutes later. And you're going to continue to do that until you're falling asleep at a good time. So you may get down to 4 hours at night. Eventually you're going to get pretty sleepy, and we're going to be able to get you on a good schedule. We can talk about this more if we need to get to that point. That is a really important point to resetting your sleep habits. Next is pharmacological treatment. So that means medications. So there are some medications that you can do to help you sleep. One of my favorites is melatonin. So melatonin can be bought over the counter. It's a supplement. The problem is are you actually getting melatonin? Because the FDA doesn't regulate what it is. I use melatonin myself. The recommended dose is 3 to 5 milligrams, and you do it somewhere between 1 and 3 hours before bedtime, whatever works out for you. Give it time. It's not a quick fix. Give it at least a week. So take it every night, 1 to 3 hours before bedtime, and don't quit on me. If you continue to do it, you'll see an improvement, hopefully. This helps with your sleep cycle. It helps with getting you back to where you need to be on your circadian rhythm. There's other medications. I do not encourage Benadryl. Lots of people use Benadryl or Tylenol PM. It does make you sleepy at first, but the sleep that you get from it is not good sleep. It's not a quality amount of sleep or quality type of sleep. You're not getting into those deep cycles of sleep that you need. Some of the medications that we do by prescription are trazodone is a common one. There's not a lot of evidence behind it, but some people get some good results. Amitriptyline, which is a tricyclic antidepressant. Lunesta, which is one that is in a class that is not my favorite. So you have Lunesta and Ambien. Both Lunesta and Ambien are part of a class called gabapentinoids, or They hit GABA receptors similar to benzodiazepines. The problem is, if you're over the age of 65, you should not be taking one of these medicines, and you should not be taking benzodiazepines. The reason being is, number one, we know that they increase sleepwalking. Number two, there's been some incidences of people having getting up in the middle of the night and not remembering it and doing things they didn't remember. And the biggest one is hip fractures. We know that it increases the amount of falls that you have and the amount of hip fractures if you're over the age of 65. The other reason these are not my favorite, though I do use them sometimes, is because they're very addictive. Once you get on them, it's very hard to get off of them, and you build a tolerance to them. So if you started out at 2 milligrams, eventually you're going to need to be at 5 milligrams. If you're on 5 milligrams, eventually you're going to need to be on 10. And if you're on 10, eventually it's not going to work near as well anymore, and we're kind of stuck. And it's going to take a while to get off of these because you're very tolerant to them, and your body needs them now to sleep. So many times I try to wean people off of these if at all possible. People who do shift work, they work really well for because we just use them every once in a while. And it's fine to use them every once in a while. We don't build that tolerance up near as much or the addictive potential of them. The other ones that I use are Belsomra. Belsomra is a newer medication. It was found out in patients who have narcolepsy. They had a problem with this chemical, and so Belsomra is that chemical, and it helps us to sleep and get in sleep longer. Now, it's also not a quick fix. It takes at least a week to fully kick in, and so give it time. Some people have bad nightmares with it. It's rare, but it can happen. There's also Remeltion. Remeltion is actually approved for people with blindness, and it's called Non-24. You may see those commercials. So people with blindness don't have that circadian rhythm like they used to, or they may not have ever developed it because they were born blind. And so Remeltion hits those melatonin type receptors at a much higher dose and really helps people get that circadian rhythm back. Now, it can be pretty expensive unless your insurance covers it, so it's not usually my first choice. There's some other choices that are down the line, some antipsychotic medications such as Seroquel that I usually do not use unless we are just at our last choice. Benzodiazepines are used. You'll hear people using temazepam or Klonopin. I don't use those for sleep. They're also very addictive, and they can be very dangerous. At high doses, they can cause you to stop breathing. So they're not my first choice at all, and usually I don't use them at all. And if you come in on one of those, we really try to get you off of those. Lastly, there is cognitive behavioral therapy. So cognitive behavioral therapy works on some of the sleep hygiene things, but it also does a few other things to teach your brain how to act towards sleep. You can usually go to either a psychologist or a psychiatrist for this, and unfortunately, that's usually out of town. There's a program up at Vanderbilt in Nashville for this. There's also an internet program with cognitive behavioral therapy called Shuti, SHUTI, and the website is www.myshuti.com. That's SHUTI. Now, it is $135 to be enrolled in this program, but it has pretty good evidence. So we talked about insomnia today and given you a few tips on how to try to control it yourself first. We talked about keeping a sleep diary, talked about the sleep hygiene. We talked about sleep restriction, which is not my first choice, but we can go to that. Talked about medications that we can use that hopefully are short term and we can get you off of them. And then last is cognitive behavioral therapy. If you have any questions, please let me know and we'll get through them together. Thank you and have a great day.